Welcome to Module 2 on Principles of Providing Oral Health Care during the Antenatal Period. By the end of this module, you will describe the importance of providing orodental care during pregnancy to promote the oral health of pregnant mothers and their newborns, and discuss how orodental care can be integrated into antenatal care programs. Welcome to the Unit 1, Promoting Oral Health of Pregnant Mothers and Their Newborns. This unit will cover importance of providing orodental care during pregnancy to promote the oral health of pregnant mothers and their newborns. In the Module 1, we discussed that pregnant women with poor oral hygiene are susceptible to several specific oral diseases and conditions such as gingivitis, granulomas, and bleeding gums, and higher occurrence of dental caries. We also reviewed some of the common myths discouraging pregnant women to seek oral health care during pregnancy. We discussed that pregnancy is a period to motivate mothers to modify their lifestyle towards positive health change in their habits and behaviors. Furthermore, pregnant mothers usually come into contact with health workers several times during pregnancy. Based on all these points, you will agree that pregnancy is indeed an important period to provide orodental care to promote the oral health of pregnant mothers. Does poor oral health of pregnant mother have any effect of the pregnancy outcomes? In short, the answer is yes. As we learnt before, the infection in gums is a common condition in pregnant women with poor oral hygiene. When a pregnant woman has excessive bacteria growth in her mouth, these can enter the bloodstream through her gums and travel to the uterus and placental tissues. Some studies have shown an association between maternal oral disease and adverse outcomes like preterm delivery and even low birth weight of the baby. Now that you know about the importance of good oral health in pregnancy, let us look how a healthy pregnancy contributes to good oral health of the newborns. As all of you know very well, normal pregnancy lasts for about 40 weeks and it can be divided into 3 stages. The first trimester starts from first week and lasts till the 12th weeks. The second trimester starts from the 13th week and lasts till the 28th week. The third trimester starts from the 29th week and lasts till the 40th week. The tooth development starts around 5 to 6 weeks of pregnancy when the tissue starts condensing and thickening. Baby's gums develop around 8 to 9 weeks of pregnancy in the form of 2 U-shaped bands, one in the upper and one in the lower jaw tissue. Within each band, 10 tiny tooth buds develop at 8 weeks. In the future, these tiny buds transform into the 20 baby teeth. By the end of second trimester, that is 28 weeks, majority of organ development is complete. It is important to note that below the baby teeth buds, the buds for permanent teeth also start developing from the 5th month and continue till birth. The initiation of the first permanent molar starts around 4th month of intrauterine life. Therefore, nutrition and dietary habits not only affect the baby teeth, but also affect the permanent teeth of the baby. By the second trimester, the pregnant woman had learned to adjust to her pregnancy. The fetus is growing and maturing, but not grown to an uncomfortable size. This is considered the safest period to provide dental and oral care. Fetal growth continues during the third trimester, that is, from 29 to 40 weeks. During the third trimester, the roots of the teeth start forming. These roots eventually connect to the jawbone with a supporting ligament. It basically anchors each tooth in place. For rest of the pregnancy, the tooth buds continue to grow and mineralize. Usually, the teeth grow out of the jawbone and appear in the oral cavity 6 to 8 months after birth. Rarely, babies may be born with small teeth in the mouth. These are called natal teeth. This is not a common condition and may need to be extracted by the dentist, as it may be painful to breastfeed the child with natal teeth in mouth. Let us now look at the role of the pregnant mothers in promoting her oral health and the oral health of the baby. 3 things are critical: taking extra care to maintain oral hygiene, ensuring good nutrition, and seeking orodental care. First and foremost, the pregnant mothers need to be encouraged to take extra care to practice good oral hygiene. These include brushing teeth with fluoridated toothpaste twice a day, replacing toothbrush every 3 or 4 months or more often if the bristles are frayed, limiting sugary foods and drinks, not sharing toothbrushes with anyone. It is recommended to consult an oral health care team or professional during pregnancy for a checkup and to get advice on any issues. Note that getting oral health care, including the use of intraoral X-rays, pain medication, and local anesthesia, is safe throughout pregnancy. While ensuring good nutrition is very important throughout the pregnancy, there are several key nutrients that need specific attention. Eating food rich in folate and foods fortified with folic acid are advisable. These are locally available green leafy vegetables, legumes, and fruits. WHO recommends a daily oral iron and folic acid supplementation with 30 milligrams to 60 milligrams of elemental iron and 400 micrograms of folic acid for pregnant women. Calcium is a mineral that builds your fetus's bones and teeth. During pregnancy, mothers should meet their calcium requirements by taking calcium-rich foods such as milk and dairy products, sesame seeds, almonds, and dark green leafy vegetables. In populations with low dietary calcium intake, WHO recommends a daily calcium supplementation 1.5 to 2.0 gram oral elemental calcium for pregnant women. Besides these trimester-specific recommendations, there are dietary guidance throughout the entire period of pregnancy for the oral and dental health of both baby and mother. Let's recall from Module 1 that if the pregnant women are deficient in vitamin C, they can suffer from bleeding gums and tooth mobility. The required amount of vitamin C can be obtained by consuming locally available citrus fruits. In Module 1, we learned that during pregnancy, there is an increased risk for dental cavities because of cravings for beverages and food with free sugars. To prevent this risk, it's advisable to avoid foods high in sugar like candy, cookies, cake, and dry fruit. Also, avoid beverages high in sugar like juice, fruit-flavored drinks, or soda. Instead of these drinks, drink water or milk. All pregnant women should ideally be offered orodental care during their pregnancy. It is recommended to consult an oral health care team or professional during pregnancy for a checkup and to get advice on any issues. It is encouraged that pregnant women are provided with all relevant information we discussed so far as part of the maternal health program by the antenatal care team as early as possible during the pregnancy so that she could discuss all her concerns and get the accurate information. It is to be noted that getting oral health care to attend to urgent oral condition, including the use of intraoral x-rays, pain medication, and local anesthesia, is safe throughout pregnancy. Generally, it is advisable that all non-urgent medical or surgical procedures are performed after the first trimester. It's important that the pregnant woman visiting the oral health care teams for any treatment shares the information that she is pregnant. This information will help the dental team provide the best care. Congratulations! You have now completed Unit 1 of Module 2, Promoting the Oral Health of Pregnant Mothers and Their Newborns. In the next unit, we will look at the importance of prenatal care in improving the oral health of pregnant women.